Hello, everybody. This is Dr. Kevin Connors. We're going to talk about what we do with Lyme disease, autoimmune disease, vaccine injury, and such. Anything other than cancer in this clinic is on this website right here that you're on. The My Hope for Lyme, though it's more inclusive than Lyme, that's our base website. You're watching this video because you're interested at least in what we do and what we offer here. And I recommend you explore our site. That's the key component. We could have spent a lot of money doing a fancy video and paying a company to do a video, but we'd rather put our money in adding information on our site, gathering as much information and offering as much free information. That's part of our ministry here. And you're going to see as we explore these options that you have with our clinic that that's really where our heart is. When you look at our website, you'll see our clinic. You can click on that tab and see who we are and get some faces that go with the voices if you communicate with us. And then our protocols, our self-directed care is our key. And that links back to our classroom. In our classroom, we are going to be constantly updating and adding information so that you can choose to try to take care of yourself. And we fully realize in taking care of Lyme and autoimmune and cancer patients over the last 30 years that a lot of people with chronic disease are financially tapped, and they are struggling to try to find Lyme literate doctors that will care for them that they can afford to go to. That's what the purpose of this entire website is. Yes, we do have a nutritionally guided plan and a full life plan that people can choose to utilize and utilize our services. But our classroom with all the information, all the books that we give free of charge is really for your benefit. The classroom has information on Lyme disease, genetics, vaccine injuries, autoimmune detoxification, and this will be added to. So by the time this video is out, after a period of time, there'll be more tabs in the classroom as well. Please look at those things and follow our blogs. These are some of the faces that you'll see. This is Diane and Angie. If you do communicate with our clinic, we have other employees as well. Everybody, if you do decide to get clinic-directed care, start with a case review. A case review is communication with myself or one of the practitioners, about 30 minutes where we go over your history and what's going on currently and decide, what would be a good fit for you. Is it to just follow self-directed care and use our classroom? Is it to utilize our nutritionally guided plan or our full life plan? Part of that has to do with your finances. Part of that has to do with your current set of knowledge and what you want to do. So we're not here to try to sell anything or push anything on here. We're trying to give you the best offerings that are best for you. That's the whole idea. We want you to choose what's best for you and give you those options so that you can take care of yourself. If you are catching this video on YouTube, go to myhopeforlyme.com. You'll see all our information. This is a screenshot of our Begin Here page, because that's where you'll start. Makes sense, right? Begin here. You start with a case review. You can look at all of our information for free. We're always adding to our blogs and videos and store. So look at that information. I hope this helps. Blessings, Dr. Connors.